Welcome everybody and good morning. Thank you to our host schools, David Posnack Jewish Day School, Donna Klein Jewish Academy, Scheck Hillel Community School, and Yeshiva High School for all of their help in putting this weekend together. We are in the Bader-Ginsburg division. The teams competing in this division are Scheck Hillel Community School, Frankel Jewish Academy, Gann Academy, De Toledo High School, San Diego Jewish Academy, and Tarbut V'Torah. A round of applause for all of the teams. I want to thank the judges for being here today and also for the hours of work that they put into reading your work, commenting on it, and thinking about your work in preparation for today. So I'm actually going to ask each judge to stand and face the group and introduce yourselves to the group.
Hello, I'm Rabbi Michael Loving, and I am the rabbi of Temple Decor in Coral Springs, which is about an hour.
Good morning, everyone. David England, your rabbi at the Torah congregation in Beaufort.
Hi, I'm Kurt Klein. I'm the rabbi for the Greater Miami Jewish Federation and the chaplain to the Federation, and this is my second time doing this for 11 every.
Thank you so much. So as you know, each team will have 8 minutes for their presentation, followed by 8 minutes of Q&A with the judges. There will be 5-minute breaks in between each group, and there will be 2 longer breaks in the morning. Once the group is done and there's a break, the following group can begin to get set up so that they're ready to go after the break. Rabbi Hillel Green will be our timekeeper in the room. He will give you a 1-minute and 30-second warning, and after the 30 seconds are up, he will cut you off. So just keep that in mind. It's nothing personal, but that's how we do it. And after the final team has presented, there will be a lunch break out in the courtyard, and the closing ceremony will be at 12:30 back in this room. So without further ado, I'd like to invite up Scheck Hillel Community School.
Rabbi Waldenberg, Rabbi Fuchs, Rabbi Allo, thank you for meeting with me. I need your advice and insight. My father, Leib Goldstein, he has late-stage Alzheimer's dementia and suffered a heart attack 1 week ago. He's unconscious and being kept alive by a ventilator and an IABP. I'm his only family and legal guardian, and the doctors have asked me to make the difficult decision of what to do with my father. They have given me 3 options. One is to attempt a bypass operation, giving him a 60 to 70% chance of living out his full lifespan. Option 2 is to allow the IABP to fail on its own and be removed, and then they would keep Dad sedated until he passes on. The final option is to wake him up and manage his heart issues through medication. Doctors say patients generally must stay in the hospital and will die within a few months with this option.
What specifically would you like advice regarding?
I would like your help with 3 difficult yet important questions. What actions am I allowed to take? What actions must I take? And what guidance can the Beit Din give me about this difficult decision?
There are some important distinctions that halacha makes regarding those who are in the process of dying. Philip Bentley's book, The Shattered Vessel, The Dying Person in Jewish Law and Ethics writes, human life assumes a prime value in Judaism, but there's a recognition that issues surrounding the beginning, preserving, and ending of life are complex, sometimes setting values against each other. It is important to understand a few key concepts. A ghosis is a person who is in the active process of dying, likely within the next 72 hours. Chayesha is one who is only expected to live for a short period of time. While Rashi in Rabbi Chaim Schachter's article, High-Risk Medical Procedures, defines this as a day or two, it uses imprecise language, allowing acronym including Rav Chaim Ozer to extend this to 6 months or even longer. Zman Ma is a terminal diagnosis where death is certain, but the amount of time is difficult to determine.
So what status is my father in, and how does this impact the decision?
It's important for you to understand Judaism's overarching perspective regarding someone who's dying. The primary source for this is in the Gemara, in Avodah Zarah 18a, that discusses the story of Rabbi Chana ben Tradion, who was killed for teaching Torah but refused to speed his death. He did, however, allow the executioner to remove obstacles that slowed or prevented his death. This position is later codified in Shulchan Aruch Yored De'at 339.1 by Rabbi Moshe Isserlis, who writes, "It is forbidden to cause the dead to die speedily, but if there is something there that causes delay of the exit of the nefesh, it is permitted to remove it from there, as there is not in this any deed at all, rather he is removing the prevention." Sefer Hasidim 7:23-4 states that one may not cause a person to not die rapidly. In other words, one may not delay the death of someone who's gosses. Sefer Hasidim uses the example of a gosses whose death is delayed by one close to that house chopping wood, and the neshama is unable to exit, and states that they must remove the wood chopper. Conversely, Sefer Hasidim states that if a person is gosses and says that he is unable to die until they put him in another place, they must not move him from there. This shift to another place would speed up the gosses person's death, something which is forbidden as well. This is evidence that one can neither speed up nor slow down the death of someone, demonstrating the importance of a natural death. This is supported by the Darkei Moshe in Yored De'at 339, who states that one who closes the eyes of a dying person is considered like a bloodshed. A natural death is paramount, and it's absolutely forbidden to hasten the death of a person. The Shirtei Geburim in Moed Katan states that the act of shoving a pillow from underneath a gosses person is an evil practice and an act that it would seem correct to forbid, further underscoring the importance of dying naturally.
I understand the value that Judaism puts on life and the importance of having a natural death. But what status is my father in?
Leib is suffering from two conditions, degenerative Alzheimer's and heart failure. Each condition will put him in a different status. While Alzheimer's is not medically cause for death, complications from Alzheimer's are often leading factors in the cause of death. In fact, the Alzheimer's Association states on the website that Alzheimer's is the sixth leading cause of death in the United States. This puts Leib in the category Zmanma, and depending on the progression of the disease, he might be a Chai Shah. Alternatively, Leib's heart disease and his deteriorating heart condition mean that if no medical steps are taken, is considered a ghost sense. This is based upon the fact that the IABP devices are rarely last longer than 1 week, and Leib has already had his for 6 days. Furthermore, the doctors do not know if the IABP can be replaced if it fails. While surgery may remedy the situation, it does not change his current status. It would seem that Leib is primarily a ghost based upon his current heart condition, and if this was successfully addressed, it would put him in the second category of Zmanma due to his advanced Alzheimer's disease.
You came in asking what actions you were allowed to take according to Jewish law. It would seem to me that option A, where your father undergoes a bypass operation, is certainly permissible because he may live for several years. This decision to save Leib's life is supported by Talmud Sanhedrin 73a. Do not stand idly by the blood of your peer. Tosafot Avodah Zarah 27b also states that in a case of receiving help from an idolater, we choose the possibility of life over certain death, supporting the concept of the importance of life. Even though the surgery is high risk, surgery is permitted. The reason for this is explained in Rabbi Chaim Jachter's article on high-risk medical procedures, where he claims that anyone expected to live only for a short while, Goss says, is forbidden to engage in a medical procedure if there is a chance greater than 50% that the procedure may kill him. This implies that in a case where the possibility of success is greater than 50%, like your father's, it would certainly be permissible. Rav Moshe Feinstein is quoted in the same source stating that one may go through with the procedure even if there's only a safek rachok, slim chance, that the treatment is effective and it may be performed, even if it is more likely than not that the procedure will kill the patient. Thankfully, your father's chances of success are significantly higher, and his chance of living out his normal lifespan are realistic. For that reason, and since we choose the possibility of life over certain death, the option for surgery is permissible.
While I agree with Rabbi Abba that the surgery of chin is permissible, I might suggest that another option is permissible as well. I recognize that it is a very sensitive subject, but the option of allowing the IABP to fail and keeping Leib sedated until he passes is also permissible. The option is permissible based on the fact that as the ghost says, Leib's life should not be extended by artificial means. This would directly contradict the ideal of allowing ghosts to have a natural death. Removing the IABP would allow Leib to pass with dignity and free of pain and discomfort. Allowing Leib to pass is what the Tzitz Eliezer, chapter 13, section 89, would refer to as a mitah yafa, a death of dignity. In this source, it is further stated that to remain a figure with many tubes would destroy the tselem Elohim that is in him. While I caution you to make the decision based upon what is best for your father and not for you, it is my opinion that it is a halakhically viable option.
Shayna, you asked if there was an option you must choose. I would suggest that there's an option you must not choose. The option of waking your father up and managing his condition with medication for several months. In this case, Leib would still be considered a ghost as his death is imminent and may occur at any moment, however it is being delayed by medication. In addition, taking this course of action would mean that your father will lie crippled, constantly confused to his late-stage Alzheimer's, and likely in pain for the remainder of his life. In response to Mincha Shlomo, Rabbi Shlomo Auerbach states that one needs to be merciful towards the sick, to lighten his burden, and somewhat quiet his pains. According to this ideal, the quality of life that Leib will lead after being awoken is a valid fact to consider, and is serious enough to make this course of action forbidden. Though it may seem that Yigar Moshe will allow one to wake up Leib, this is not the case. Our source states that it is troublesome that people may think that there is no need to heal someone who is, God save us, mentally incompetent. While it seems that the decision to forbid this option directly contradicts this point, there's an important distinction to be made in the wording of the source. Yigar Moshe implies that people may think that there's no need to heal mentally incompetent people. However, there's no healing that takes place in this option. This option is slipping or prolonging the ghostly status of an elderly man who is not mentally well, and therefore the case that Rav Moshe is referring cannot be compared to the one in hand.
So what guidance can you give me?
The decision is yours, and you must think about what's best for your father and what he might want. However, we will remind you about the critical role that natural death plays in Jewish law, and to steer from waking him and keeping him on medication.
I'd like to know a little bit of the status that you determined of the. You made a distinction between taking things that will prevent the death of an individual, things that are a monea. So my question is, what is your halachic determination of the status of the IABP? Because you said in source 3, the last source, you seem to imply that taking them off that would speed up a death, which would be forbidden. So how do you understand this, the halachic status of that instrument?
Can you please repeat the question one more time?
Sure. The second option is to keep him on the IABP, correct? And he's going to be sedated all the time, never be conscious. That's one of the possible options that you gave to him. So, but you said that to remove it would be a problem. Yes?
Yes.
So my question is, how do you determine, what is your determinant of what is the nature of that device, halachically? Is that something that's speeding up a death, or is it something that's preventing a death? Preventing the natural death, because your major argument is a person should have the right to die the natural course of a death.
He should definitely die with dignity and of natural causes, and the IABP is currently prolonging his death and holding it and pulling it out. He is currently goses, meaning he will most likely die within the next 72 hours, and this is only prolonging his death, so keeping it any longer will not really change.
Why are you advocating option 2?
We're advocating.
So why are you keeping the second option 2, if you just believe that it's a monea? It's just like the equivalent of, for example, somebody chopping wood, where you can remove something that's just preventing the natural dying process.
Option 2 is still a viable option because the IABP is supposed to be failing soon, and that would allow him to die peacefully because he would be sedated the entire time. That way he can still die with dignity and without pain.
And in addition, it is his 6th day at the IABP, and basically within that, so as I was saying, he's in the IABP for 6 days so far, correct? And so basically within the 7th day, because you know how IABP, according to some sources, we say that an IABP kind of lasts up to 7 days, maybe more. He's up to the 6th day. So basically, as she was saying, the dignity of death is really important, and how basically the IABP may help him at a temporary state, but eventually we would know for a fact that yes, we would not kind of speed his death. But I just say, like again, as what she said, the IABP is a useful technique that we can use. Not only that, but also A as well.
So in permitting option 1 and permitting option 2, these seem to me to be divergent in terms of the amount of pain that's being inflicted on the patient. So can you talk a little bit about how you weighed permitting 2 really different options for the daughter to be able to choose from, and how you specifically, for a team that is clearly focused, and I think it's an appropriate focus on mitayafan, death with dignity, and really trying to give an option that can prevent all that. The surgical option is a severe one medically, and will no doubt, if Leib does wake up from the operation, he will be in pain, and he may or may not be able to process that based on his mental status. So is there one option, let me put it specifically, is there one option that you prefer, Shayna, or Shayna, as the student wants to mention, and how did you approve two divergent options?
Well, the thing is that this is a very, very personal case, and Shayna personally would have to pick based upon what would be best for her father and what she knows her father would want. Saying that I'm not Shayna, I don't really know what her father would want in this case. So that's why we gave her the two options, because it really depends on what would be best for her father and what he would want most. Because if she thinks that he would want to go through with the surgery and he would be able to be fine with that, then she can pick that. But if she would rather think that he would want to go through with the other option, then she can pick that also.
Ask a difficult follow-up question. Do you have a halachic source for that kind of reasoning, or is that a moral and ethical imperative to give her these choices based on what she thinks her father would want?
Well, it is both halachic and a moral choice. It's very moral choice though. There's, here, give me a second.
In terms of a moral choice, let me give you an example. So my dad, unfortunately, he was in the same situation as Leib. He had cancer, and the doctors gave us an option. Either we would pull the plug and just, let him die peacefully, or we will let him, give us some time for us, to give us our goodbyes and everything. Eventually, in my own opinion, as again, we actually said we're not Shayna, right? Our opinion, my opinion, was that, I know he's suffering, and I know that he's been through so much with his cancer, with his nose and everything. But I think that just giving a little more time, just to see his family, just to see his kids, especially for me, because I was 13 when he passed away, unfortunately. But I think that just seeing him for the last time, smiling a little bit and everything, I guess that's more of a moral choice. Maybe Shayna was a way of approaching that way. That's my opinion, but again.
That would actually be option C, because option B, he's going to be sedated. He will not be ever.
No, I'm saying that, no. That's medications, sorry about that. Because option C is actually giving him medication, therefore he would use that medication for several months until eventually the Alzheimer's would do something to him, maybe causing death. But my example basically is that we gave him at least a few more hours, with no medication, nothing, just to see, kind of giving him a relaxing death in a way. So that's what we did, but we did not give medication. That's a moral approach.
For the halachic side of it, we can look at Talmud 173a, do not stand idly by the blood of your peer, because that would allow him to have a greater chance of living out the rest of his life, however short or long that may be, considering his Alzheimer's. And even though the surgery is very high risk, not that very. Rabbi Chaim, Doctor's article on high-risk medical procedures, where he claims that anyone is expected to live only a short while is forbidden to engage in medical procedure. There's a chance greater than 50% that the medical procedure might kill him immediately, but in this case, it's lower than 50% that it will kill him. Therefore, it is halakhically allowed.
I have a question. I realize that you're... Are we time? Never mind. Well done.